This is Dr. Lloyd Hay here at Hay Clinic, and we're just seeing our patient Kathleen back for her scoliosis follow-up. And Kathleen is 63, and good news for her today in that her scoliosis is nice and stable. She has a little bit of a lateral listhesis here at the L3-4 level that we're going to keep an eye on and measure that, but her curve seems stable. If we flip to the side view, she does stand a little bit pitched forward on the side view, a little bit more, but her sagittal balance actually looks quite good. So Kathleen just brought in this wonderful sheet here that was sharing about her weight and managing weight and how that affects her quality of life, and pain is one of the things we're just talking about. So Kathleen, can you explain what this graph is about?
Yes, I noticed that the more weight I have gained, the harder it is on my back. So I'm trying to keep my weight down. In fact, my goal weight is to be at 130. Have gotten up to 150, and it is a lot more painful. So I'm trying to
so explain what those X's mean.
The X's, throughout this year, this has been really a good year for me. It started last year. I was at 136, and that's a fairly good weight for me, even though I'd like to be a little bit less. So this year has been pretty good, and so I've got green X's, meaning that my pain was just basically everyday aches and pains. The small green X means that it's just okay, it was a good day, few aches and pains. The darker X, or enlarged green X, means that I might need to take a Motrin because it's just a little more uncomfortable. When you go over to the purple X, that meant I had sharp pain that day.
Got it. So, and that was actually when you were at your peak weight.
Right, and that's when I was 150.
Yep. And so you're bringing that down, which will help. But this goes along with what I teach a lot of my patients, that for every pound that you lose, it actually takes 5 pounds off of your low back down here. And that has to do with the biomechanics where the weight is here. So when you do lose that weight, it should help that back to feel better. So thanks so much for sharing that. We'll share that with our other patients.